Botox typically takes about, I would say, anywhere between 5 and 7 days to get a full effect. One of the most common scenarios that I'll get is, patients come to me because they have an event and they say, I just want to get some Botox treatment prior to this event. When should I do it? I don't think getting Botox injections the day before or the day of the event are ideal because it takes about 5 to 7 days to see the full effect. So I'll tell them, just come about 1 to 2 weeks before your event, your outing, because that's when you'll get your kind of most desired effect. Factors that can influence the effect of Botox, one of the most important ones is the amount of units used for a specific muscle. If you use an incorrect number of units for a muscle, you're not going to get a desired effect. But if you go to a trained professional who knows exactly how many units to use for a specific targeted muscle, you're going to get your most optimal desired effect. Botox typically will last the patient 3 to 6 months. And what I tell them is, when you look in the mirror and you start to see those fine lines or wrinkles again, because the muscle is now activating again, and if they bother you, then you can always come back for another round of injections. But it's not something that's medically required or necessary. It's just a product that typically will last about 3 to 6 months. Personally, I wouldn't recommend Botox injections as long as there's still product that is active and working. So if a patient comes back to me, say 6 weeks after her Botox injections and she had a great result or he had a great result, they tell me, I just like to kind of double down and get Botox again. In my practice, that's not something that I do because I follow these patients over the course of time. I don't just do one injection session and say kind of goodbye. I follow them over the course of time. I like to see how many units did I use last time, what was my follow-up result, and then I kind of customize the units for their next session. I like to kind of follow the chart and say, I did it at this time, this is how many units I used for this area of the face, this was my result. It looks like it's wearing off now, so I know exactly how to kind of customize the product again. I don't just kind of randomly pick a number and just inject it into the face. When I see them, I like to think, how much did they have? How long ago was it? What was the result? So then when I see them again, in my mind, I know, okay, it's wearing off this many units. This is how many units worked. I don't need to go less. I don't need to go more. It's kind of very individually based. It's really like a customized treatment.